Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
Client education, and again, I can't stress this enough. The better educated our clientele is, the better decisions they'll make and buy into and follow our recommendations and be much more compliant. And in doing so, the patient will reap the benefits. Things like getting in early, coming back in 4 months or in 6 months, establishing good home care protocols. All of those things we want to happen when we're managing these patients to achieve the best success in caring for these patients. So let's talk about some client questions here. How do you convince the client that a tooth or mask needs to be removed? Again, education. So I'm going to use things like, especially when we're talking about extraction, I'm going to let them know what the diagnosis is. We've got bone loss, most likely causing discomfort, even though we're not seeing it, secondary to periodontal disease. And unfortunately, the bone loss is just too far advanced that we are unable to save this tooth or these particular teeth. And that is primarily, in a nutshell, what the diagnosis is, what we found, and what the treatment plan is. That's the best that you can do. If we have to convince them, that sometimes happens where they're just not, I'm not convinced, and we show them the x-ray when they come in, or we can take a picture and text it to them on their phone. I've had to do that with patients under anesthesia. And they see the x-ray and it's obvious. That is worth, 1,000 words if we can show them what that x-ray looks like. An oral mass, no question. We need to biopsy and get a diagnosis. And again, let them know that oral masses, most are benign. However, some can be locally invasive and start to invade the bone. So the sooner we get that taken care of, the better. The better for your pet in the long run. In dentistry, again, our approach is to be proactive, to find pathology early, treat, to prevent silent suffering and unnecessary suffering down the road for their baby. What percentage of owners do you have coming back in for follow-up, post-treatment radiographs and care? The percentage, I would say, is probably 80 to 90%. We do 3, 6, 8 month yearly prophies. That's probably at least 25 to 30% of our caseload per week, both in Atlanta and in Orlando. And so because of the way that we've presented all this material, because of the x-rays we've shown them, and the proof that we know how to treat periodontal disease, this is what we need to do, we get excellent compliance on them, returning. And a big component of that is the fact that the first visit went very, very well. They went home, they were awake, they ate, they were back to normal within a day or two, if not sooner. They were comfortable. So all of these things, they were pleasantly surprised when I do my callbacks, a day or two later after the procedure, and they, it's like he had nothing done. I can't believe it. I'm so surprised. they're going to remember that, and it's going to make them much more compliant in coming back, in addition to the education with regards to the diagnosis of their patient. Question from Emily regarding home care. Do you have a list of recommendations for owners to use at home? Absolutely. We talk about the Veterinary Oral Health Council. Now, we typically will dispense home care. Like we dispense pain management, we're going to dispense home care because this is an important component to the whole procedure. If there is a particular home care product that they don't want to try, then we're going to hand them a list, and you can actually go on this website and fix this here so we can see that website. The website is vohc.org, and you can pull up the entire list, and it's categorized for dogs and cats for chews, diets, rinses, toothpaste. All of that's included in that list, and anything that has the VOHC symbol on it, we know that they've presented data to the council. The council's evaluated that data that says, yes, you've proven that this product is effective against plaque prevention. And that's what we're looking for. And so there's so many products out there. We use this as a qualifying resource for your clients. You can use any product on this list, and it even tells on the list where they can get it from, whether it's prescription, if they can order it online, if they can get it at PetSmart or any dog supermarket. So it's a really nice comprehensive list. We typically will have a few products in hospital that we dispense on a regular basis, but if for some reason they don't want to go with that, then we're going to give them this list to make their good decisions and give them a good resource. We offer oral cleansing wipes for clients to go home with if they put their fingers in the mouth. What do you think of these for aid and teeth cleaning? Depends. Does it have the VOHC symbol? That's my question to qualify. Do we know if it's effective or not? And if it's effective against plaque control and has the VOHC, we are good to go. Jill asks about Oravet chews. And we love Oravet chews in conjunction with the Oravet application. And if the dog has enough teeth left to be able to take advantage of these, we absolutely recommend, because this particular product is really nice in preventing plaque, and it's pretty benign. It's made primarily from alfalfa, so it's all natural for the most part. And all it does as the patient chews it is coats the teeth in a wax barrier sealant. And it's just one chew a day. They're very palatable. The pets like them. And so it's a very nice addition to any home care, because it's easy for the client. It's pleasant for the pet. So that lends itself to much better client compliance. What do you recommend for cats? Good question. Because yeah, cats are tricky. Not a lot available out there. These are our two go-tos for cats. Both of these products are VOHC approved. Cat treats by Tartar Shield, as well as Healthy Mouth, water additive, or food topper. And both are effective, have the VOHC, so we know that it's effective against plaque prevention. And again, easy for the owner to do anytime we can give our pet a treat. That's great, positive, easy way to do home care. The Healthy Mouth can be used as a food topper. So again, very easy. It's flavored. Comes in chicken, blueberry, salmon, tuna, beef. So whatever the cat would like. Again, very easy to do. and so we get much better client compliance. So these are really two nice alternatives. But again, that VOHC list has a number of products listed for cats as well. We will send home a list of VOHC approved products for owners. When it comes to owners asking what products, do you do something similar? Yes, always VOHC products. During the discharge, you show clients images before and after. We typically don't. The before and after is more or less cosmetic. Yes, it's very clean, it's pretty. What we show our clients is the pathology and why we treated that patient. So if we have especially a periodontal patient with significant bone loss, we are going to show them those most profound x-rays. Before and after approach concentrates too much on the cleaning. And remember, it's not about the cleaning. That's certainly preventative at this point, but as far as treating this patient, really doesn't have a huge benefit. Yes, it looks nice, but it's more or less cosmetic. We need to instill in these clients that treatment, assessment and treatment is our main approach to any dental patient, so that we can prevent any kind of further trauma and silent suffering with these patients. So that's what we primarily focus on. Kate asks, how do you deal with clients who are extremely stubborn on dental rads? And my answer is education, education, education. Again, reiterating that cleaning without assessing has no real benefit to your patient. If there's disease present and we just clean the teeth, there's disease that's present in there, most likely, because we know that 85% of patients over the age of 3 have some degree of periodontal disease. And we know that if we find it early, we can treat it and we can prevent tooth loss. That's our approach. Cleaning teeth does not accomplish that. We need to be able to assess and diagnose appropriately, and the only way we can do that is with dental x-ray. And dental x-rays are absolutely non-negotiable. It's not worth the risk of anesthesia to just clean the teeth, because we're not providing any benefit to that patient. So that's how we kind of approach that. The assessment and treatment has those benefits far outweigh the risk of anesthesia, and just cleaning is not part of that. Cleaning is preventative once we've treated disease. But if disease is present and we just clean the teeth, unfortunately that disease is just going to continue to progress. And when we do take x-rays, we're going to see advanced disease that maybe we could have prevented extractions had we done that sooner.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.